Yes, Carol, the government of Saskatchewan doubled down and restricted public and private gatherings to a max of 10 people, and also came up with a list of essential businesses and also what has to close effective tomorrow. In Alberta, Premier Jason Kenney made it mandatory for people returning from outside Canada to self-isolate, and the fines, if you're caught, they're intense, up to $500,000 for more than one offense. We've got a lot to get through today. Welcome to our viewers in Saskatchewan, Alberta, and across the country. To walk us through everything, I'm joined by Rob Brown, the host of CBC Calgary News at 6, and Nancy Carlson, the host of CBC Edmonton News at 6. Let's start with the bigger picture and take a look at the total number of cases in Alberta and Saskatchewan right now. In Saskatchewan, there are now 86 cases of COVID-19. That's up 14 since yesterday. In Alberta, the cases have increased by 61 for a total of 419 cases of COVID-19. And tonight we start in Calgary with Rob Brown. Rob, the government of Alberta is cracking down on people who are ignoring COVID enforcement orders, and that could mean some significant fines.
It could, Sam, as you hinted at off the top there. The Premier playing both good cop and bad cop in his availability today, striking a positive note out of the gate, pointing out that Alberta is fourth in the world when it comes to per capita testing, and emphasizing the recovery rate of those who have been identified as coronavirus carriers, all meant to encourage people to continue to follow those mitigation measures around mass gatherings and self-isolation. Now, here's the bad cop. Those who don't follow those measures, and the Premier says far too many people aren't, well, as mentioned, they could now face fines of up to $500,000 through the courts. It seems the more likely scenario, though, is that they'd be slapped with a fine of $1,000 by either a police or peace officer. Either way, Jason Kenney says it is time for a crackdown.
Today, we are moving from asking people to act responsibly to instead using the full force of the law to legally require that people act responsibly to protect public health.
Now, also meant to protect public health, new screening and cleaning standards for facilities like long-term and continuing care homes. They come, of course, after Calgary recorded its first COVID death inside the McKenzie Town Continuing Care Centre, a woman in her 80s. There are now 6 confirmed cases in that location alone, including a staff member, and CBC News has spoken with the wife of a man who's a resident at that centre. We're not identifying her because she fears repercussions for speaking out. She tells us that staff are not making sure the residents are physically distancing, and she's worried. This isn't the only case of its kind in the Calgary zone. We're learning today there's now an outbreak in a place called Nelson Home, an adult group home for people with developmental disabilities. So now, more measures.
Today, I am ordering additional directions that all healthcare operators and service providers must follow. Facilities under this order include all nursing homes, designated supportive living and long-term care facilities, seniors' lodges, and any facility in which residential addiction treatment services are offered under the Mental Health Services Protection Act. These new guidelines are mandatory.
Okay, Rob, so that's the latest on the fight against COVID. Any update on the fight for a bailout for the energy sector?
Yeah, the Premier didn't go there today, Sam, but the federal finance minister was talking about a relief package. Speaking before the Senate, Bill Morneau made clear his primary focus at this point is supporting people, though he did say his officials are in contact with Alberta's oil and gas sector on an hourly basis, with the intention of delivering some sort of package ASAP.
This work that is going on right now. I don't have the final answer on the exact hour that will be delivered, but I'm not talking about weeks. I'm talking about hours, potentially days, that we can ensure that there's credit facilities for especially the small and medium-sized firms in that sector. And then the larger sectors, the 10 largest companies in the oil and gas sector, most of them do have existing credit relationships with their banks, in most cases with available credit, but they were under strain too. So we're also looking at individual issues in that sector.
In the meantime, more energy giants continue to slash capital spending to a running total of up to $6 billion with a B dollars so far, Sam.
Wow, thanks, Rob. Rob Brown is the host of CBC Calgary News at 6. To Saskatchewan now, where there is also a whole new host of restrictions today. Social distancing regulations are now even tighter. Public and private gatherings are now restricted to a maximum of 10 people. Premier Scott Moe is trying to balance the COVID-19 sanctions with industry. He says he knows things are extremely difficult right now for those working in a so-called social isolation economy.
I know today that we are asking a lot of everyone in Saskatchewan. Whether you are working in one of the businesses or services that is staying open, or whether you work in one that is now closed and you are at home. Each and every one of you need to know that you are doing your part. Every one of you is part of a massive civil defense effort to protect our people, to protect our families, and to protect our province.
Premier Moe also released a list of critical industries and businesses that are allowed to stay open. Those include healthcare workers, first responders, transportation, government, media, construction, and some retail and banking services. But there is a long list of businesses that are required to close their public-facing services tomorrow. Basically, if a business sells something to the public, it can only do so online, by phone, or through pickup or delivery. Grocery stores, pharmacies, and home supply stores are exempt. Looking at Saskatchewan's numbers, as I said earlier, there are 14 new cases today for a total of 86. There are now 4 people in hospital. 2 of them are in intensive care.
This is a number that will keep changing because experience from other Canadian jurisdictions has shown that most people have mild symptoms, they do well at home, and after a period of 2 weeks, they clear the infection. Some require a short period of hospitalization, which may be as little as less than a week, and then can again come home and stay at home till they've cleared the infection. But a few may require a longer hospital stay or ICU care.
There are 4 cases that came through community transmission in Saskatchewan, but that number has not increased since yesterday. 2 of those cases are in Saskatoon, 1 in Regina, the other in central Saskatchewan. Prior to this, the rest were related to travel. The government also announced a new toll-free number for other questions about COVID-19 not related to personal health. You can reach it at 1-855-559-5502. The province insists that only health questions should be directed to 811. The prairies are leading the country when it comes to COVID-19 testing. As of Wednesday, Saskatchewan had conducted more than 6,200 tests for the virus. Saskatchewan's premier says his province is only second to Alberta when it comes to testing. Earlier this week, Saskatchewan's chief medical health officer announced an expansion of who can be tested. This means those who have developed COVID-19 symptoms will be able to get a test if referred, even if they haven't traveled outside of Canada in the last 14 days. Officials say they expect the number of cases to continue to climb. Alberta recently made changes to who's being tested for COVID-19. Let's go to Nancy Carlson in Edmonton. Nancy, in your province, they're giving priority to people most at risk of either developing extreme symptoms or infecting others in the community.
Yeah, Sam, and included in those people most at risk are seniors. Now, Rob mentioned the recent death in a Calgary seniors residence and the positive cases there. Well, today we learned 2 Edmonton seniors residences have positive cases of COVID-19. One at Rosedale on the Park in Oliver, and 2 cases at Shepherd's Care Kensington Village. This growing number of cases, there are now 100 in the Edmonton zone, is concerning to everyone. The Vice President and Medical Director of Alberta Health Services took time out of his day to speak with me and answer some of our viewer and listener questions. And one of the most common one being asked is about the measures AHS is looking at taking to ensure there's enough space in a worst case scenario.
Will we be using tents or other devices out in parking lots, for example? There isn't an immediate plan to do that, but certainly we have done that in the past at times, and the contingency plans are in place in case we do need to go that direction.
And Dr. Jaffe really stresses the effort to stop the spread and flatten the curve. And one of the efforts that we have seen is stores closing their doors. Well, that has led to a spike in parcel delivery. And one local Canada Post union says not enough is being done to protect workers. And it could have major ramifications during this already challenging time for Canadians. The Edmonton president says at local depots, there aren't enough protective equipment measures being taken. So there aren't enough masks or gloves gloves or hand sanitizer, and they say management has been slow to implement social distancing rules. He says it's increasing the risk of postal workers who are out in the community where they could easily transmit the virus to the public.
We've given Canada Post the opportunity to do everything practical and reasonable to make sure our work environments are a safe place for us to do our duties so that we could help Canadians, because that's the key here. We probably already would have taken job action if it wasn't for the fact that we understand this is a crisis. We understand that we play an important role in helping Canadians.
Now, a spokesperson for Canada Post says they do have social distancing protocols in place. They are also cleaning more, and they're doing whatever they can to ensure it is a safe work environment.
Nancy, in other industries in Alberta, they're struggling to survive in this new reality, but you're looking into some businesses that are actually seeing a boost in revenue during this pandemic.
Yeah, a lot of restaurants and bars were forced to shut their doors, so they've switched to delivery and pickup orders to keep revenue coming in. But some stores are operating business as usual, and business is really good. So traffic is up for those catering basically to our vices. Liquor and cannabis stores are seeing a lot more of their products leaving the shelves in the midst of this pandemic. And people who usually, let's say, go for a bottle or two are buying cases. That's according to the Edmonton wine shop we spoke to. And the newest legal vice, cannabis, is also seeing a new high.
They're coming, they're buying enough for 2 weeks, 3 weeks. So definitely, we're more shipping. We're seeing we've never had so many orders of shipping. We have an online store that we're actually having to get. We've kind of ignored it because it's never been a big part of our large, higher percentage of sales force. But we're really seeing it increase now to the point where we have to make it work better, keep our inventory better. So yeah, it's good.
Business has been going really good. It's been up like almost 50% increase in sales since what we're normally having. It's been a lot busier, a lot more foot traffic, a lot more people are spending a lot more.
Now, with everything happening in the province with COVID-19, there has actually been a lot of talk about Alberta's last major pandemic. That was the Spanish flu. But are comparisons justified? Our Patrick Connolly went to answer that, and we practiced social distancing in the process.
I spoke to a few historians, and of course, things are more complicated than that. There are those that agree with yes, they are justified, and some that just say no, they aren't.
We see efforts to try and link the non-pharmaceutical interventions we're taking today to what happened in 1918 and to use that to support what we're doing today. As an historian, I can say the evidence is still largely out on how effective those things were in 1918.
And Sam, it really is interesting to hear the parallels. So you can actually check out the whole story at cbc.ca/Edmonton. And one more thing, that is also where you can find my full one-on-one interview with Dr. Jaffe.
Thanks, Nancy. Nancy Carlson is the host of CBC Edmonton News at 6. Many Calgary companies are rallying around healthcare workers. Some restaurants and businesses are offering free delivery and free products like facials and meals to Alberta Health Services employees and other essential workers as ways to say thank you. Others are buying food to be delivered to hospital employees. You can look for hashtags like Support Local YYC, Thank You Healthcare Worker, and Thank You Health Heroes. Food banks across our regions are scrambling to keep up with demand right now. That includes the food bank in Airdrie, north of Calgary. They say personal food donations are down by 2/3, and some fundraisers and food drives have been canceled. Now, the Airdrie Food Bank says it relies on donations and is not government supported, but it's hoping for government to step in. If it doesn't get additional support, it might have to close its doors in 2 weeks.
I still have to pay my staff. We still have to purchase large amounts of food that we haven't had to. I just received a food order today that is not usual for us. It's $8,000 for the food that I had to bring on site that's going to continue to feed our kids and our community the staples that they need. So, wow.
A Regina athlete had the 2020 Olympics in Japan circled on his calendar. But with the games postponed, he's decided to hold off on his retirement as well. Jan Stein competes in 2 events, the 100-meter dash and long jump. He hopes to be a member of Canada's Paralympic team when the games do happen, but at 38 years old, he knows an extra year will make it hard for him to continue competing against kids, as he puts it. Still, he knows the physical and mental hurdles of his training are a small issue compared to people who contract COVID-19.
I'd rather see everyone survive first than worry about a sport, right? I'm sure that NHL, NBA, every sports is in the same boat as me right now.
Stein is encouraging everyone to listen to the advice of health officials, stay home, away from other people. He can't really resume his training while social distancing measures are in place. He can't run on city streets with his prosthetic leg, so he needs to wait for tracks to reopen or for the snow to melt so he can train on the grass. And before we leave you tonight, a brand new statue was unveiled in Edmonton today, and it features a couple of familiar hosers. A Bob and Doug McKenzie statue from the series SCTV now sits in the city's downtown core. The famous skit Great White North features Rick Moranis and Dave Thomas as Canadian brothers. The series features Canadian greats like Martin Short, Catherine O'Hara, and Eugene Levy, and was shot in Edmonton in the 1980s. Unfortunately, neither of them could attend today's event because of the COVID-19 outbreak.